Hi, my name is Dr. Elissa Cohen with Pelvic Floor For Moms, and I'm talking about diastasis today. The big question postpartum, and actually relevant during pregnancy too. How do we get diastasis better? What do we do? So, first things first, let's talk about how to check for it. I mean, ultimately, if you're going to go to pelvic floor PT, they will check for you there. But it's nice to get a baseline at home to see, is this a problem that I have? Should I be concerned about it? Things like that. So, I'm going to lay my back here. Work at my belly. So diastasis means the space between those rectus abdominis muscles. So what we're trying to do with your fingers is to put your fingers in that abdominal space, and then when you tighten them, you'll be able to feel how far apart they are. So we're going to check above your belly button, at your belly button, and then below belly button. So I'm going to start with 2 fingers. I'm going to get my fingers placed, try to feel the edges a little bit, and then you can support your head, do a little crunch, and then as you do that crunch, you should feel those ab muscles come up on either side of your fingers, and you can be able to count then how many fingers of space it is. So we'll talk about that in a second. So we check there, we'll check at your belly button, and then we can check below your belly button as well. Okay, so now note how many fingers it is, but the other thing that you want to notice too is when you're feeling that space, how firm is it? So when you squish on it, does it feel like you can squish really far down in, or does it feel like, okay, well, this is about as firm as my abdominal wall, because that's ultimately what we're looking for. The other thing to look for then too is when you do a crunch like this, do you get this ridge? Do you get a dome down the middle? I don't know if I can do it, but mine is not doming, so you won't see that. But so that's the other thing that we're looking for as well. So in the clinic, what I want to see, it is 100% normal to have that abdominal separation postpartum. Our belly has to expand, those fascial layers have to thin and lengthen in order to make space for that baby. So very normal to have separation. What we care about is how that separation comes back together by like 12 weeks postpartum, right? We want to give that tissue time to tighten, heal, just like we're giving the rest of your body time to heal. So if you're 6 weeks postpartum and you have some separation still, probably normal and fine. Then anything narrower, anything less, 2 fingers or less, is not clinically diastasis. That could be considered like normal variation. Anything 2 fingers and above would be a clinical diastasis recti, whatever you want to call it. So if you're 2 fingers, that can be a variation of normal. What I want to see then is if you're at 2 fingers and you're wondering, is this bad, is this not bad, whatever, what's the firmness of that space? If you can feel 2 fingers, but that space feels really firm, probably fine. If you feel that 2 finger space and it's really squishy, or you see that doming, that's probably where we want to address it or see someone to just make sure that we're doing the right strengthening things to help get that more firm in that space. Can we get it, if it's at 2 fingers, can we get it less than 2 fingers? Potentially, I think by challenging the system and getting stronger. If there's some soft tissue restrictions or like body tightness in different places, that can contribute to why that diastasis is staying 2 fingers apart still. So some of those things, addressing some of those things might be helpful as well. But so that's what we're looking for at home. If you're trying to check about diastasis, you're concerned, those are the things I'm looking for in the clinic. So let's talk about some of the things that might be contributing to that space if you still have that space. One of the things that we want to talk about is thoracic and rib cage mobility. So one of the reasons is our rib cage gets wider when we're pregnant, just to like as baby pushes up in there, those ribs are gonna widen. And if your rib cage stays wide, we want this angle. So if I tuck my hands up under my rib cage, we want the angle that's created to be 90 degrees or so. If our angle is wider than 90 degrees, it's going to be pulling apart on that diastasis still, which means that we need to create some mobility in that rib cage to allow those ribs to come down and in. The other thing that can happen is that angle can be less than 90 degrees. That usually is more of like a tightness issue. People are over gripping their upper abdominals, things like that. So that can be a separate issue, but also an issue. The other thing that we care about for thoracic mobility is that if you're reaching overhead and you don't have the spine mobility to reach overhead, your rib cage is gonna flare up, right? If you're getting a plate off of a high shelf, whatever, you're gonna flare up. That's gonna pull on those rectus abdominis muscles and not allow them to stay in that, you know, connected, close to each other position. So in order to make sure that you can do activities above your head, as you reach up, keeping that core engaged, but then also, if you're lacking that shoulder or thoracic mobility, we want to make sure that we have thoracic extension and rotation. So both of those motions are going to contribute to enough thoracic mobility to be able to reach up without flaring your rib cage. You can check out that that would be the stretching playlist. I have one of my favorite thoracic rotation stretches on there, which is going to get you some rotation and extension. We'll end up getting some like foam roller extension, any way that you can get extension, whether it's over a foam roller, over a Pilates ball, even just like if you're sitting at your desk, pushing on your desk, leaning back over your chair. You can do some seated thoracic rotation if you're at a chair, things like that, or some stretches on the floor from that stretching playlist. So that's one thing you want to make sure that we address. Strengthening effectively is ultimately what's going to be the best thing to get that core canister and that diastasis strong and stable. So you can refer to the strengthening playlist, but we're always starting with that candle breath. So we get that exhale, engage those pelvic floor and transverse deep abdominals. Transverse abdominis is what's going to help create tension in the space of that separation. Obliques are going to come in from the top and help you create stability above the belly button. This is often what takes the longest for people to like get strong and stable again. Obliques are going to play a large factor up here too, so we want to make sure that we're strengthening those as well. But using that candle breath when you're doing strengthening to make sure that transverse abdominis is firing, and then you're using muscles on top of that. It's not that transverse abdominis is the only muscle that we care about or the only muscle that we want to use, but it tends to be the hardest for people to find, I think, and it should be on underneath rectus abdominis, like your flexor muscle and your obliques, which are going to help you rotate. So all of those we want to strengthen, but make sure TA stays on beneath that. But then we want to make sure that we use that candle breath, that exhale, and engage pelvic floor and low ab with all daily activities. So again, if you're going to lift something from the floor, if you're picking up baby, we're going to exhale with exertion. So as you exert, as you push up to stand with baby in your hands, engage pelvic floor, low ab. Even holding baby and standing up from the couch, exhale, engage, and stabilize the core. Picking up the car seat, that's another place we want to get that nice deep core stabilization. Using that candle breath, exhaling with daily activities is going to help manage pressure in that core canister, which, let me go over this for a second because I didn't go over it to begin with, but a lot of pelvic floor stuff tends to be about pressure management. So if we think of your core as a canister with pelvic floor on the bottom, diaphragm on the top, deep abdominal muscles in the front, low back muscles in the back, all of that stuff has to function and work together in order to be an effective canister and managing pressure in the canister. So if we think of that canister as a can of soda, and that can of soda is closed and it has soda in it, whatever, it'd be really hard to smash, right? But if we poke a hole in the side or we let the soda out, then it's going to be really easy to smash that can. And so if we think about your core canister, diastasis that is not strong or functional is going to be a hole in your soda can, right? And therefore it's going to be difficult to manage that abdominal pressure, and therefore it's going to put pressure on other things, put pressure down on your pelvic floor, put more pressure on low back muscles. This being not strong and stable is going to affect other things in the kinetic chain, and so that is why we care about it, right? And so we want to make sure that we're managing pressure in that core canister with all daily activities. So this is why these things matter, right? And honestly, with that diastasis, there's also that like aesthetic aspect too, right? How do we get our bellies to come back to normal again postpartum? And this is going to be part of that. Okay. Another thing that I see people doing postpartum when trying to strengthen or whatever is way overusing those upper abdominals, so like obliques. People tend to grip those upper abs, and if you're doing that, you might even see like a line in like right beneath your rib cage if that's like the pattern that you use. But when people do that, sometimes they're not really using those lower abdominals either. So you can see I'm getting this line here, but also I kind of have that like little mom pooch situation because I'm not engaging my core effectively. And so just by practicing letting go of those upper abdominals, but in lieu of those upper abdominals, we want that transverse abdominis to be what is supporting and stabilizing us. And just making this small little switch and learning how to effectively engage transverse abdominis both with daily activities and doing exercise, and learning to let go of those upper abs, because that can be a really strong holding point for someone. When I say contract their abs, they go, oh, upper abs. We don't want that. That's not necessarily functional, because tightness there is going to push down in pelvic floor, create pressure down into that lower belly, create that mom pooch sort of situation. So finding TA, like letting go of upper abdominals, is going to help diastasis heal better, but also help that aesthetic aspect of what people want their abdomen to be looking like. And then the final thing is, I feel like there's so much concern about like, what's diastasis safe, and like being really conservative with exercise when it comes to exercising postpartum and diastasis healing. We want to challenge that system to some degree. So you have to learn what's safe for your body at the point that you are at. So if you are having a really hard time finding that transverse abdominis and engaging those deep core muscles, or even engaging obliques with harder activity, you're going to get some of that doming with anything that you do, and we don't necessarily want that. What we don't want is a hard dome where you're not managing pressure using that deep core system, and you're getting uncontrolled pressure out into the diastasis where you're getting that dome, but it's like a hard dome because there's pressure from the backside. That's just gonna perpetuate the diastasis. But if you're getting a small little dome that's like squishy when you press on it, that means that you just have some like lengthened tissue there that's kind of doming and popping out. That's okay, because just like muscle, fascia adapts to the stress that's put on it. So if we stress that fascia by doing some more challenging exercise, that might cause a little bit of dome, but you're doing your best to engage that deep core and managing that pressure. That's gonna help it get stronger with time, right? But if all you're ever doing is like laying on your back and doing some straight leg raises, and you still get a little bit of dome, and so you never progress past that, it's never gonna get tighter and stronger and more rigid. So we can do planks, we can do, go back to CrossFit, we can do really challenging things, and ultimately that's what is gonna help our core be better and stronger, as long as we're doing it effectively and knowing in our bodies what is safe, what should I be engaging, am I doing it well, am I doing it safely, am I doing it correctly. And that's where seeing somebody can be helpful, just to get you on the right track, knowing that you're doing the right things. So let me know in the comments if you have any questions, and hopefully that's helpful.